Hello, hello, everybody. How are you? Awesome. Well, thank you for hanging out with us. We know it's kind of late here. To everyone online, good afternoon, good morning, good evening, good night. Thank you for hanging out. We know it's happy hour time. Don't worry, we have a little surprise for you at the end. I'm not making drinks yet. But we are thrilled to have you with us and have you connecting and joining with us. We have a jam-packed program for you, and you're gonna walk away with enough information to understand how to build a business case for equitable healthcare. So as we continue on, I'm just gonna click to the next slide. It's not up.
Hey.
Okay,
There we go.
we're back, we're up. You can see it? Wonderful. You may notice that we are using the Mentimeter tool. This is great. You can go ahead and scan the QR code to interact with us today. For those of you that are online, please do the same. If you're using a web browser, you can go to www.menti.com and enter the code. Once you're in, go ahead and heart that so we can know how many people are here interacting with us today. Oh yeah, look at those hearts coming in. That's what I like to see. Oh yeah. Everybody's good? I'm taking my cue from the audience, everybody at home, so. Woo! All right. Employers today are facing many challenges: difficult economic environments, limited access to healthcare, and changes to policy and legislation. We all know about that. We know that there are over 500 anti-LGBTQ+ bills out currently. Health inequity remains one of the #1 standing things for the LGBTQ+ community and other underserved populations. You may notice that I am on stage with 3 amazing cis white men. Does this surprise anyone? When we're looking at the climate that we're in now, so many of our partners chose not to travel here because they are Black, because they are brown, and they do not feel safe. So we want to acknowledge in this space that these gentlemen are here because they are allies to our community as well. Today, I am joined by 1, 2, 3, Alon, Jeff, and Caleb, which you will meet later. And they're going to share with you how they built the business case for health equity at their organizations. I've been doing all this talking, so who am I? I am Siobhan Jackson Manuel. My pronouns are she, her, hers, and I'm a client success manager at Included Health. For me, health equity is very important. I identify as a lesbian, I am Black, so I've often had many opportunities for discrimination when it comes to healthcare. So that's why this topic is so critical and important, and all of you that are here watching this session, you are doing the work to make sure healthcare is accessible for all. So let's have some introductions. I'll start with you, Alon.
Sure. Nice to meet everybody. Alon Glazer, use the pronouns he, him. I'm a managing director and partner at the Boston Consulting Group, where my day job is in technology strategy. Prior to BCG, I was at Accenture for a very long time, and I served as the North America Pride sponsor, ERG sponsor, when I was there. And as a gay dad via surrogacy, benefit equity is very important to me and an area that I feel very passionately about. So very excited to be here and have this conversation with all of you. Thank you.
My name is Jeff Shade. I'm a senior manager in our financial accounting advisory services practice at EY. I use he, him pronouns. I've been working in the health science and wellness space for the better part of the last 12 years. And so when it comes to things like health equity, it's a personal passion project of mine. And I'm really excited to talk to you about it today. Even though it's not part of my day-to-day job, it's something that's really fun to be a part of, or I shouldn't say fun, it's really exciting to be part of this group here today.
Hi, my name is Caleb Edwards. I use he, him pronouns. I am a senior operations supervisor and the global lead of our Pride Plus Allies employee resource group at Micron Technology.
All right.
While whenever we get into this conversation, you'll hear that a lot of the work that's happened at Micron may not have been work that I drove myself. I'm excited to represent the stories of team members that have done this work for us, especially as a company that's headquartered out of Boise, Idaho. So I'm looking forward to this conversation.
Thank you. I am honored to share the stage with these three amazing advocates and leaders who are paving the way for our community within their organization. If we haven't met yet, Included Health is the leading way with a truly connected and cohesive experience to deliver greater health care to employees without all the headaches, the hiccups, and the go around and the back and forth. Our LGBTQ plus health offering is the leading, and I want to say this, we are the leading. So you're gonna hear from a lot of people. Our LGBTQ plus health offering is the leading dedicated care concierge and healthcare navigation system. So we improve care equity. We also increase the trust in healthcare, and we reduce care avoidance. So,
Maybe.
this is great. This is great.
They could just stare at our faces the whole.
I mean, you can look at us, but on your phones, did it go to the next slide? It's still live? Okay. So now that we know a bit about, well, that went kind of, I don't, these magic moments. Okay, this is the slide I was looking for. So now that you know a bit about us, we want to know about you. So you can select all that applies, but if you could go ahead and select what closely describes your role so we can know who's all with us. So I see a lot of affinity group and ERG leadership. That's wonderful. Executive leadership as well. Nice, nice. So if you need help with the choices, there are 5 of them. So we're looking at executive and leadership. We're looking at benefits, HR, and total rewards. Looking at affinity group, ERG or BRG leadership, affinity group, ERG or BRG member, as well as you fit in a different category. You thought this sounded a little cool and decided to check it out. We love that too. Wonderful. So now that we know a little bit more who's in the room, I'm going to turn it over to Jeff. And so Jeff can give us a little health equity 101.
Yeah. So I mentioned that I work in financial accounting advisory services at EY, but as I'm an accountant by trade, and as an accountant, I really kind of love definitions. We kind of get lost in what's the actual definition of something. So I wanted to talk a little bit more about what is health equity, how do we define it, what does it mean to us, and really it comes down to saying health equity is where healthcare outcomes and healthcare costs are not determined by factors like race, ethnicity, gender identity, socioeconomic status, and sexuality, right? We want healthcare outcomes and healthcare costs to be determined by what they are, and irrespective of the things that provide for those differences, right? And so it's equitable health as a whole is aspirational right now, right? So it's something that we as a community want to work towards, but we're not quite there yet, and that's why we're here talking to you today, why Included Health exists, right? Because we're moving towards health equity. I say it's aspirational, but what I really mean is it's an imperative, right? You're all sitting in the audience today or online, right? Because there's a moral imperative. We'll talk about why there's a financial imperative, right? As an accountant, I like to know the debits and the credits, right? There's a financial imperative to it as well. So how do we get there, right? Well, we got to ensure that everyone is afforded the access to care that they need, the quality of care that they need, and at an affordable cost. So really those 3 areas: access, quality, and cost. Right? So why do health inequities exist? So we've got this nifty graphic here that shows some of the clinical and non-clinical reasons why health equities exist. So there's this structural inequities. If you were listening to Lily's keynote today, she talked about the isms, right? So racism, Sexism, transphobia, homophobia, those are all part of the structural inequity that just exists in the fabric of society today. So that inherently brings bias to the health ecosystem. There's also the policies and laws. I'm probably preaching to the choir here in this room, but federal, state, local laws, a lot of them have inherent bias in them when it comes to how healthcare is run, especially in the US, but also globally. The next piece is social determinants of health. So those are going to be things like the environment, access to housing, things like safety and access to food have real big impacts on your health. So food deserts are a huge epidemic in the US today, right? There are many, many places. I come from Chicago originally. Chicago has some of the largest food deserts in the entire US, which is pretty insane to think about a major city having food deserts. But without access to good food, quality food, it impacts health, right? It's a social determinant of health. You've got socioeconomic conditions, right? So things like inherent wealth. If you're born into a wealthy family, you're gonna have better access to care, quality of care, and you're not gonna worry about the cost so much, right? And then health literacy is one that I'm particularly passionate about. I don't know what the statistic is today, but I believe like 10 years ago, there was a statistic put out by the National Institute of Health that said the average health literacy grade in the US was like a C-, right? People just don't understand what they need from their healthcare environment and how to have the conversation with their providers. And then the health ecosystem is really a clinical setting. So what are the things happening in the clinical setting that lead to disparities and inequities in healthcare? So those are gonna be things like, we often hear the story of doctors don't listen to Black women, right? So that is a clinical bias that just exists as part of the structure of healthcare. And all of that leads to these health disparities that are really avoidable differences, right? We know they exist and they're fully avoidable. So let's talk about what that means from a cost standpoint. So as I mentioned, I like to think about the debits and credits. It's billions of dollars with the B is how much these avoidable differences are costing us in the US today. So on the screen here, you have some statistics that we wanted to highlight and why the economics and financial incentives for providing equitable healthcare are really important, right? And why all of us up here today are talking about it, not just from a moral standpoint, because obviously morally we want to make sure everyone has appropriate access and quality of care, but financially it's really important, right? The one statistic I like to highlight is that 5 trillion there. So as you can see on the screen, it says over the next 5 years, the US economy could grow by $5 trillion if the racial gaps just for Black Americans were closed. So there's a financial reason that we should be investing in this, and why all companies, not just healthcare companies, but all entities across the US, why you as a taxpayer should invest in health equity.
I learned so much just listening to you right now. So I work in this field and I'm learning. I'm pretty sure it's probably like mind blown, right, for all of you listening, but this is wonderful. I really want us now to learn more about these leading organizations that are talking health equity. So Alon, I'm gonna turn to you. Can you go ahead and kick things off and share more about the work that's being done at Boston Consulting Group?
Yes, I can. But before we do, I'm going to make fun of Jeff. You know he's an accountant because his slide says 978 billion instead of 1 trillion. I like that detail.
Gotta be specific.
Yeah, and I'll echo something that Caleb said earlier too in terms of leadership roles. I'm relatively new to BCG, and I'm going to talk about BCG in my experience, but also want to give credit where credit is due to the many folks that are not me that actually got us to the footprint that you'll see on the slides here. But BCG is a global multinational company. We've got 30,000 people around the world working in different spaces for our clients. A couple of diversity statistics, 48% of US staff now are women, which is great. And 45% of our new hires are one or more element of diversity, which is cool. The affiliation and ERG count is also quite high, which I find great. There's about 78% of folks enrolled in at least one ERG and 30+% of folks enrolled in 2 or more, which is awesome. If we click ahead, I'll talk a little bit just about our benefits landscape, and particularly the LGBTQ benefits landscape. But bucketed things into 3 big categories here. One around family building, which is a very important and expensive process for many people, especially LGBTQ people. So just making sure that leading benefits are available for folks that are trying to expand their families by surrogacy, adoption, other fertility support, and also making sure that people have the leave that they need to care for their children when they have them. Healthcare navigation, very germane to the conversation today with Included Health, but just making sure that all those benefits that are listed on this slide are accessible to people who need them and that they're understandable to people who need them. BCG has also benefited in the US at least by having one insurance provider. And so we've got a pretty strong relationship with that provider, have a dedicated line of support for LGBTQ employees into that provider. And so that streamlines the process a little bit as well. And then on the right-hand side, just a couple of other categories, major categories of care around gender-affirming care, as well as travel reimbursements for those services, as well as other services in our current legal landscape, as well as benefits around mental health space, so making sure that there's accessible mental health counselors and support networks and advocacy networks as well.
I am going there. I'm joking. No, it's wonderful to hear all of these inclusive benefits. So Jeff, I know you just took a break from speaking, but I would love to know what's going on at EY.
Sure. You all have to continue to hear me speak. Apologies. So at EY, obviously we're a group of financial service individuals, right? A group of accountants. So we like to say, how do we understand how value is driven? How do you translate things to dollars? And when it comes to things like health equity as an umbrella, it's really hard to translate into dollars, right? So think about things like investments in health literacy today. Absolutely will have a value down the road because there will be a cost savings theoretically as health literacy grows in the US, but how do you measure that and how do you translate that to dollars can be really difficult. So what our EY Center for Health Equity has done is created this framework here where we think about health equity and how to measure some of those areas. So first defining what are those categories of value that we focus on, and then what are those focus areas within those categories, and ultimately how do we measure? So what are the metrics? So if we take just one of these examples here, so let's take the equitable health outcomes at the very top. Well, that's a consumer-driven value. Our consumers, think about the EY as consumers, is if we find equitable healthcare outcomes, the way we might measure that is by creating metrics for access to care. Do the consumers within the US health population have the right access to care? And how is that value driven? It's through the demographic information that we're able to gather. And ultimately, at an enterprise level, individual entities, right, you can translate that into direct market share, right? And it's not a direct pathway, but it's a way for you to measure how health equity initiatives can actually drive long-term value.
That was amazing. Thank you. I love the way it's written down and it's really easy. It gives a blueprint.
Yes.
And it helps with that case study that we're talking about, right? We're building that case. So last but definitely not least, Caleb, can you give us a little bit more insight into what's going on at Micron?
Of course. So this summer in Pride Month, we actually published our first LGBTQ plus US benefits guide. And several of the highlights are here on this slide. One that I'm personally extremely proud of is our Coming Out in the Workplace guide. This was something that our employee resource group built hand in hand with different parts of our company, including the DEI teams and several of our well-being resources. We also have a very strong suite of trans-inclusive health benefits, which we'll talk more about how we got there here in a little bit. Medical travel benefits. Our ERG also helped build gender transition guidelines, similar to the Coming Out guidelines, to support both team members who are transitioning as well as the leaders of team members who may go through those procedures. As well, we are very happy to have our Included Health concierge service, as well as some of the other benefits listed here. And on this slide, we have a couple of quotes from our LGBTQ plus US benefits guide. And I think there's a question where we're going to dive more into stories here later on today. But, it's a very strong statement of support for our team members and one that we consistently hear makes a difference in the lives of people, and we're really proud of.
I'm proud of it too. Thank you for doing the work. We truly appreciate it. So you've met us, we've met you. You've learned about Health Equity 101 with Jeff. You've learned about these 3 amazing organizations. Now it's time to start our discussion, and we're gonna jump into the questions. So let's discuss. I love that. So we know healthcare benefit recommendations can come into organizations from multiple different avenues. You can get a recommendation from an ERG that's starting the conversation, or even the benefits team that's looking for healthcare companies that can support their employees. So I'm very curious to know what that entry point was at your organizations, and how did the conversation get started around equitable healthcare? And we can start with a line and just go down the line.
Sure. Yeah, I'll speak from a BCG hat and an Accenture hat here, but I've seen both sides of this. A lot of times the conversation can be driven from ERG and member needs, as well as top-down from benefits teams, total rewards teams that are going out and doing due diligence. I would say that most organizations and the organizations in which I've worked have a structure for evaluating benefits across all of the spectrum of benefits available to employees, and on some frequency basis go out and explore the market and say what's best in class. Sometimes that frequency works in your favor, sometimes it doesn't, right? If it's every 2 years or so, or 5 years, then that might not actually meet the need of your there are a lot of ERG leaders and members in the room, it looks like, your membership or your employee base if you're in a total rewards role. And so how do you split the difference? And I think that comes from listening to members, and that's where the ERGs, affinity groups, really play an important role, is bubbling up those needs and marrying those with what the rewards teams and HR teams are putting together.
So at EY, our business is people, right? So we, our product, right, what we sell is our people. So when it comes to things like our benefits packages and how we develop our equitable benefits and our trans healthcare benefits, things like that, it really is brought from the bottoms up, right? People standing up and raising their hand and saying, we need this, we want this. And things like surveys that can be done through the ERG groups and other things really allow a place for folks to have their voice heard. And so a lot of our benefits today were driven from the workforce, from the people.
At Micron, our journey was a little bit atypical whenever we talk about how a lot of companies get here. And there were a few key factors for us. One of them was the Human Rights Campaign Corporate Equality Index. Whenever we started submitting our responses and trying to drive our score up, whenever we started, I think we scored a 40. The following year, we got up to an 85, and we've maintained 100 ever since. And I think that was 2018 where we got our first 100. So that was a big driver, and it was a big catalyst for us. But one of the key moments, kind of that entry point for us, was we had one team member in Idaho who came out as trans and started a transition in the workplace. And by the law of our benefits, lost medical coverage with the way the policy was written. And in conversations with legal and benefits, the company realized this is a major issue we need to address. And the company took proactive steps to get us not only where we needed to be, but ahead. We were able to make a lot of really strong strides. And the last part, whenever we talk about entry points and kind of historical, is the city of Boise passed anti-discrimination laws. Earlier I brought up, we're headquartered in Boise, Idaho. And kind of the reason why I bring that up is the state itself does not have those protections. So whenever the city of Boise created the anti-discrimination laws, it served as a catalyst for the company to then follow suit. And one of the quotes that whenever I was talking to team members this week preparing, said that those small actions can create big waves. And it's not just a city that can create those big waves, but it really is any of us in this room or online.
Small action can create big waves. I like that. So I want to dig a little bit deeper, Jeff and Alon. You mentioned a little bit about ERGs being involved. So my next question really is going to talk a little bit more about the ERG. So if an ERG is looking to start that conversation, what information should they gather? And then what ways could they go about gathering that information or collecting that information to build their business case for equitable healthcare?
Sure, I can start. Don't underestimate the power of peer pressure. So especially today with a lot of the, let's say, ESG disclosures, hopefully everyone knows about ESG, environmental, social and governance disclosures and reports that are coming out, right? A lot of entities are actually disclosing, here are our policies, here are our metrics, here's our information around DEI, around health equity, around the benefits that we offer. And so a lot of it's publicly available. So if you have an ERG or you as an individual at your company wants to put a little pressure on upper leadership, you can pull data pretty easily from Google, right? And get information, say, hey, I'm EY, what are Deloitte, PwC, and KPMG doing, and why aren't we doing that, right? That peer pressure actually does move needles at times, so don't underestimate that. And then internally, I mentioned surveys, but something as simple as allowing space for voices to be heard can also aggregate data, make leadership listen. So little things like that can really, really push things forward as well.
Yeah, what I would add there too is it would be nice if we all had easy access, and I think in some cases there is easy access to data, but also easy access to really relevant data in this space, right? And say, okay, we have measurements of LGBTQ people's engagement or attrition or retention in an organization, and some organizations do, and that's great. But when you don't, I think there's an element of storytelling through data and trying to link the discrete pieces of information, like Jeff is saying, into a story that's relevant for leadership, and to say, the first element is, why are these benefits important? What impact will they have? Will they drive retention? Will they drive engagement? Will they drive productivity? Things like that. And then, the second wave of that story is then how do these benefits actually impact those metrics, right? And that's where you can go out, phone a friend, Google, talk to peer organizations that are using benefits or benefiting from other services. And then the other source, I think, too, is using, like Caleb said, the outside measuring sticks, like the Corporate Equality Index, other statutory requirements, and use those to layer in and help build that story. The one other piece, too, that I'd touch on is there's also financial metrics associated with these things, right? And especially talking to, again, the ERG leaders and members in the room, sometimes you're not the one making the business case financially for these benefits, but you can still collect information in terms of employee retention, engagement, and things like that that are important inputs to that process if your HR rewards team is making that case for you. And so BCG has a survey tool called the Bliss Survey, which we use with our clients as well, but also use it internally to track important measures that go into this conversation around feelings of belonging, feelings of safety, feelings of inclusion that can all be tied into the data conversation around inclusive benefits.
That makes a lot of sense. And it also makes me think, you've done all this work, right? You've talked to people, you brought up your competitors with the peer pressure, you gathered all of this data now. So when is the right time to bring in those decision makers? When is the right time to bring in those stakeholders as you're building your business case? And so Caleb, I actually would like to hear that from you and Jeff as well.
Yeah, I wish that there was a straightforward answer, and I wish I could give one, but I really can't. I think in large part, it's going to depend upon where the company is at, what types of leaders are pushing the initiative, and what is the culture of the executives that are going to be those decision makers. If you have a very supportive executive team, bringing them in right from the start is probably one of the best ways to go. You build that momentum, you get that executive buy-in, which whenever I talked to my CDIO earlier this week, was one of her key recommendations is get that executive support early to help push the initiative. But if you're coming in a culture where you don't necessarily have that support, instead you may want to do some of that data pooling that we've talked about, that benchmarking, see what the other organizations are doing, and determine if you can build an intersectional approach. We talked a little bit about equity or health equity for Black men and women on this stage already today. is there a solution that you can build broad support around, something like adoption or surrogacy benefits? So, I don't think there's a clear-cut answer, at least from my perspective, but those are some of the things I would consider.
No notes. So I completely agree with that. So personally, I tend to be the person that stands up and shouts loudly, which isn't always the best way to get things done. But I would say if it's something that you are particularly passionate about, that your ERG is passionate about, plant the seed as early as you can, because having that executive investment and that leadership investment is going to be really critical to making it successful.
I like that. I also want to do a shameless plug because I wouldn't be me if I didn't. But we do offer at Included Health these equitable solutions for your organization. So we have an LGBTQ plus health product as well as a Black product. And so oftentimes when you're talking health equity, equity isn't equal. So when you're having this conversation with your organization, it's very important to stress that. You may not be able to offer it to every single person in the organization, but it's important for these members in this organization. And that's a key point that you can continue to stress. And also talk to Included Health, and maybe, we can help you out with that. So I diverted a little, but I am going to get back on track. As we're talking, we know that the benefit decision makers, they're not always having that lived experience in the LGBTQ plus community. So a lot of their information is coming directly offline or what they've heard from one or two employees. How would you go about highlighting the value that inclusive and equitable benefits bring to people of varying identities within the LGBTQ plus community? And when I say value, I mean whether it is ROI or something more intangible, like employees and their wellness and their health that you may not physically be able to put a number to. So I actually want all of you to answer this question. So I got a little spicy with this one, and we'll start here with Alon.
Yeah, it's a great question. It's an important question. I think we talked a little bit about data in the last few minutes, so I'm not going to hit that point too hard, but it is important to build, even for senior leaders, a bit of a data case as much as you can. But to your point, right, you can't always do that quantitatively, and so how do you do that qualitatively? I think it's important to talk about real people's experiences. What are the pain points that people in the organization are having with access to care, navigating your own benefit structures, finding competent providers for themselves, for their families, and using stories to make things feel real, I think is very important, especially when you're talking to leaders in the organization. And I think on a good day, everyone does what's right for the organization, right? The way that you make people feel that they're doing the right thing for the organization is to make them understand the people's lives that they're touching, I think. And so being able to tell those stories is very important. The other point, and I'll use Included Health as an example, Accenture was a relatively early adopter of Included Health because of a pre-existing relationship, but we were very vocal advocates with our peer organizations and our clients of the value that Accenture was getting out of the Included Health solution. And so just having peer referrals, I think I took about 12 referral calls in the first few years of Included Health for other organizations, including BCG, looking to sign up for services and trying to get a sense of how were actual employees getting value out of the solutions. And so I think that's relevant in this health navigation space with Included Health, but also in other benefit structures as well, learning what other peers are doing, using the external benchmarking tools, and actually finding out from people what value they're getting out of the solutions as well.
I think from an accounting firm standpoint, data and analytics is a really large facet of what we look at. So to your point, getting both the external and internal data points to say, what are the demographics of the people in our workforce? What are folks looking for? What do folks need from the data, and how can we show that? And how can we show that investing in health equity initiatives will have an ultimate return to us, whether it's through employee retention or attraction, right? That employee attraction is a big metric. Have we brought folks in because of the benefits that we offer? Are we retaining folks because of the benefits we offer? I think the other side of it is there's a real power in storytelling. I was actually at lunch today having a conversation with some folks, and it got brought up that there was at least one individual who had not such a good time navigating some of EY's benefits. And so at the table, leadership and individual leadership said, that's not acceptable, we gotta fix that, right? And so we're going to take steps to do that. And that the power of a story like that is really important.
You know, I had a laundry list of notes ready for this question, and I've totally forgotten over pretty much all I had written down. But I think one of the key points I had has already been hit on quite a bit, so I won't dive into it too much, but that's telling stories. You know, one of the other points I want to make is something that was reminded to me earlier this week, that whenever we talk about equitable health benefits, we want to tell stories, we want to provide the data, but at the end of the day, whenever we're talking about this, it's more than that. Like, we're talking about people's lives, and you know, we've heard stories time and again of how these benefits have made a direct impact on the lives of our team members in a positive way. So even if these benefits aren't utilized by the entire company or even by a majority of the company, they do make a difference for those who need them. And I think that being able to tell that story is really, really important. And I 100% had another point I wanted to make, and I have completely forgotten it. So,
well, I'll steal the microphone back from you for a second, Caleb, actually, because you reminded me of something too. To your question, Siobhan, right, of having people in leadership roles that might not have a shared identity with the group that you're advocating for, is also to tap in across segments of diversity too, and maybe you can find some connection there that's more human. You know, an example, parental leave policies, right? That's not something that's just impacting LGBTQ people, although your angle may be that you're advocating for more equal or inclusive benefits from that seat. But you can rally a bit of support from other affinity groups and ERGs to build the story, and even to drive more of a personal connection with the leaders that you're trying to appeal to as well.
So I'm listening to everything you're saying, and for most of us, when you're doing this business case, you're gonna come with all of the facts. But we also know that if you tug at the heartstrings and you hear those stories, that sometimes make an impact as well. Most times, it's that story, especially when you're speaking for benefits for a certain community. So before I go into the Q&A session where we open it up for the audience, I would like to know a little bit more about those stories and those outcomes that you've heard, that you've seen, that you've witnessed at your own organizations. I know myself, I have a story from working with Included Health, but prior to that, I was an Included Health member before I worked here, and recently married. It's COVID, the start of COVID, and my wife was deployed, so I was alone, and I needed a therapist. And I was able to use my Included Health benefits and ask the questions, and the person on my care coordinator asked me, okay, well, what would you like in a therapist? I said, somebody that can talk to, and they said, no, dig deeper. What would you like in your therapist? And I was like, I preferably would like a Black woman that works with the LGBTQ plus community. Is that okay that I asked that? And they were like, absolutely, because you want someone that can relate to you. And they were able to help me find a list of therapists that were working in the Los Angeles area. So I was able to reach out to someone to get that assistance and that help that I needed. And so that's a story that I share, just being an Included Health client before I even worked here. This was 3 years ago, by the way, so promise you, I didn't work here then. But so I want to hear those type of feel-good stories. What were the outcomes? How did you know that equitable health care is something that we should continue to fight for?
It's another excellent question, I should say. I'll tell a personal story, I guess, in starting this question. In my old world at Accenture, I advocated for these benefits. Included Health is one of them, but inclusive benefits. I helped make sure we were leading the charge in terms of equitable benefits out in the market. And when I started on the path to become a dad, I realized I didn't know how to access them. And so I tried in earnest to do it myself. And I thought if anyone can do it. I've been steeped in this space for a very long time. I should be able to do it. And I picked up the phone. I tried to call our benefits administrators. I got the standard phone tree with 22 options, none of which applied, and kind of gave up and just couldn't get anywhere with it. And it was about the same time that we signed on with Included Health, and I thought to myself, well, let's try another experiment and see if Included Health can solve this problem for me. And Colin specifically told me not to make this an Included Health commercial, so sorry, Colin, for making this an Included Health commercial. But I picked up the phone and I called my navigator, my nurse navigator, and explained the problem, and she said, I'll look into it and I'll get back to you. 2 days later, she called me back, and I had been trying this for weeks. I sent paperwork to the wrong address. It was like a month-long saga up to that point. And she called me back and said, if you call that phone tree, don't wait for the options, hit pound, then enter the code 764, and someone in Chicago will pick up the phone and they'll tell you what to do. I was like, how the heck am I supposed to know that? But my Included Health navigator found that out for me, right? And then it was easy. It was just a straight line process. I sent forms and it was all done. And in that case, I got a big check out of it and I was happy, right? But that was just me. I think a more meaningful story that really tugged at my heartstrings was we ran a similar survey, not specific to Included Health, but to all of our benefit space for LGBTQ folks 2 years ago in the middle of COVID. And someone responded to the survey and said, Included Health saved my life. And that was one of the most eye-opening things that I could have read. And then there was an explanation below that it was a person that was struggling with identity and was looking for mental health care providers and could not find someone that they jived with and was in a dark place and used the Included Health services to find a competent provider who was able to help them to a healthier, better place. And so it's stories like that that I think show the value of what inclusivity in benefit structures and access can do for people. And I think measuring those things, just to kind of take it back to our quantitative data place, I'm also a nerd, not an accountant, but at least a nerd. And look at those things and say, how are we measuring the return on investment? Making sure that you're working with your benefit providers to say, are my people using this benefit? Are they getting value out of it? And what are we doing to make sure that we're getting the return on it, right? Because if you're spending money per employee and your employees aren't taking advantage of it, there's work to do there because there's benefit to be reaped.
Absolutely. I like the implication that all accountants are nerds. It's like a square is a rectangle, right?
Am I wrong, though?
So I think from my side, I've got maybe two stories. One is a stolen story, but if you were in the keynote speaker session today, I believe it was Ari from Bank of America who noted that they were able to use the money from their health benefits to get surgery, and the money that they had saved away for that surgery personally was able to go towards their wedding, right? And I think it's a really powerful story about how health equity benefits can really have a positive impact on somebody's life, right? So I know it's a stolen story, but it was one that was meaningful to me today, so I wanted to highlight that again. Another one that's maybe a little more personal is I have an individual who I work with every single day. They are one of my favorite people that I work with at EY, and they were having a very hard time with their work-life balance, with personal things going on. And so as their mentor, I came to them and I said, hey, have you looked into EY's mental health services, our benefits for mental health services? You get free mental health care therapy sessions. It may help you here. And thankfully that person was able to take the advice, was able to use those services. And after about 2 months, they came to me and said, hey, I was about to throw my computer off the train and quit, and because I was able to find these services, I'm now much happier with life. I've got tools that I can use to add some structure that I very much needed, and I'm much happier than I was, and because of that, they're still with EY. So that's both a data point and a personal story, right? And as an accountant, I love that.
So you've both talked about how much you love data. If you've noticed, I have stayed far away from data. It's not my specialty. The heartstrings is a little bit easier for me. But, you know, I shared earlier this slide that there were 2 stories from team members. And one of those stories that I've heard over and over in a very positive way is we have a team member who is the parent of a trans youth. This story chokes me up, so I'm going to apologize ahead of time. But he's a very passionate father, cares about his kid a lot, and has shared many times how Included Health, specifically Included Health, is one of the reasons why his kid is still alive today. So, you know, stories like that are why this matters. It's why it is impactful, especially whenever it goes beyond just the team members, whenever it goes to the dependents, because we know that this isn't just an employee issue. If you take care of your employees and their dependents and their families, you help build families through your surrogacy, adoption, fertility benefits. That's what makes really good benefits. And the other thing I'll share is we had team members recently, when I was preparing for this, that shared our benefits are one of the main reasons why they're still with our company today. You know, there are challenges throughout the nation right now. And if it wasn't for our benefits, we would have lost team members wholeheartedly. But it gives them an incentive or a reason to want to belong to the company because the company is looking out for them day in and day out. And the last thing I'll say, and this is a little bit off topic, but I kind of forgot to bring this up earlier. You know, a couple of years ago, I was watching an Include Health panel. I didn't even realize it was an Include Health panel until Alana and I were talking backstage. From Out and Equal, whenever Accenture was talking about surrogacy benefits. At that point, I didn't know surrogacy benefits were a thing. I didn't know companies offered that. And it gave me a chance to go to my company and start advocating for that. And it was because of Alon, Accenture, Beck Bailey, who is part of that as well, and Included Health. And it's the ability to learn from each other. You know, we're stronger together, knowing that we have a lot of ERG leaders here today. We're stronger together, and we're stronger when we can learn from each other. And those are stories we should celebrate too.
Absolutely. I loved all of those stories, and I will use every single one of them because it's very important. As I get ready to go back to the presentation, and you will see it reappear on your screen, I do want to just take a moment here and really, really just thank all of you. Just thank you so much for not only being a change maker, but being an advocate as well as an ally for those communities that you may not identify with. So thank you once again. Round of applause. And I also want to thank all of you. It's happy hour, right? You're like, it's been a long day, and you're still here with us. To all of you that are online, thank you as well for hanging with us and learning more about health equity. Third, I want to highlight here, you see this little mixer on right there that we're talking about? Included Health is hosting a mixer tonight at the Edison. Please feel free to join us. We will love to have you there. There will be cocktails, mocktails, as well as light refreshments. So that's there for you. Located in this venue, we do have an on-site clinic. So we have 2 clinicians from Included Health that are there for you. You could do a checkup, but you could also really have a conversation with a therapist, have that mental health conversation. It is very important. We understand the climate that we're in, and we're also in a state that does not want us here, so they say. But we know that the people here have been welcoming to us. But maybe this is a trigger for you being here. Use that mental health service and have that conversation. So go to the on-site clinic, really engage, enjoy. We are available today and tomorrow until 6 p.m. And then Thursday, it's from 10:30 a.m. to 2:30 p.m. So that is available for you. Now, I want to go to our next page. This is a QR code. This is not the Menti code. This is a completely different code. This is a digital download code that can help you with structuring your business case for health equity. So we didn't want you to just sit here and then walk away with nothing, right? This is for you to download that code and really understand more about building that business case to talk with your organization. I'm going to leave this up, but we're also going to open the floor for questions. So we will have someone walking around with microphones to get the questions for you. Here they come. I'm super excited. Please introduce yourself, and your pronouns as well.
Thank you. Roxanne Meyer, she, her pronouns, CNA Healthcare. I wanted to say that, first off, thank you all so much for being here and for sharing your thoughts. You talked a lot about the inequity of the benefits being offered, but how have you addressed socioeconomic inequality in your healthcare offerings, such as the cost of your healthcare?
Good question.
That's a good question.
Go ahead.
Okay. So it's one of those things it's pretty hard to measure, right? The socioeconomic impact, right? But a lot of the benefits, especially that EY offers and that we partner with Included Health and others on, is making sure that no matter who, at what level of EY, whether you're a staff or a partner, that the benefits available to you are consistent, right? So as an example, $50,000 for surrogacy cost benefits, that's available to everyone, right? So we're working to address that internally. Now, macroeconomically, right, which is something I'm really interested in, that's even harder, right? How do you address the socioeconomic issues in population health? A lot of that comes down to, if you remember that screen of the 4 sections or the 3 sections of inequality, a lot of that is often addressed by the social determinants of health, right? So at a policy level, how do we address the food deserts, right? I mentioned that, right? That's at a policy level. Well, EY, me as an individual senior manager at EY, I might not have the ability to influence it, but maybe EY as a whole, as a company, can help put pressure on legislators, right? So that's something that can be done. And we have a voice, talk to your council people, right? Those are things that you can do individually day to day. Other things like clinical disparities, so places like Included Health and other entities that are really in, I'll say, the provider care space can really have an influence on ensuring that you have everyone has access to affirming providers, right? And so that can really address many of the health inequities, but often the socioeconomic ones as well. Apologies if I didn't answer your question, but hopefully that did.
And I'll just add a smidge. I think that's an excellent kind of view at the macro level for an organization, but there's also an element of doing what's right for specific people. And I suspect a lot of what varies dramatically from organization to organization, right? The cost of benefits and how equal or unequal those things are. But if ever there's a person that is struggling, if you can bring that to a leader who has some influence and can make a difference, I think there's a high likelihood that someone will care and help. And so I think Jeff's answer is much wider in terms of applicability to larger populations. But if you're asking about specific people that are in trouble, they can't afford the benefits or they can't afford a place to live, then raise that up and take it to a leader, and they might be able to still make a difference in a way that you wouldn't expect of an organization.
Awesome. Thank you for that question.
Hi, everyone. Lindsay is my name, and I'm with EY. Hi, Jeff. But I'm with the Canadian firm, and I'm here from Toronto. Thank you for all of your comments. I can listen to feel-good stories all day long, and I'm going to break the rules here and not have a question, but I would love to share another feel-good story that I think addresses everything that you're saying. And Jeff, you just mentioned consistency, and I think that's huge. A year and a half ago, I delivered a baby for 2 dads as a surrogate. And going into that, huge choices for my family. Obviously, it wasn't just the choice of doing it. It was the choice of what's going to be supporting, who's going to be supporting me and how after I have that baby. And I'd had very low expectations, despite being in Canada. Many people might know that our Canadian healthcare system is pretty good, in my opinion. There's debate up north about that, but I personally think it's pretty good. And we have really amazing maternity care for birth mothers. But my question to our talent and HR team at that point was, I'm not going to be a birth mother. I'm delivering a child, but it's not my child, but I'm going through the medical element of everything. But I was very aware that there was inconsistency with, say, adoptive parents who didn't deliver, like adoptive mother who didn't deliver the child gets only a portion of our standard year maternity leave. So I was kind of like, well, what do I get? And it was a lovely conversation. Beyond my expectations, it went a lot smoother than I thought. I thought I was going to have to pave some roads and break down some walls. And when HR and I were having the conversation, we kind of stepped back, and they even said, well, ultimately, you're going through a medical episode. Like you're delivering a child, regardless of whether you're raising that child or not, that you're still doing that. So ultimately, I had 17 weeks of full pay for my maternity leave, and that's 17 weeks of the standard 52. But I could have taken more if I needed. I took 17. It was great. It's all I needed. And to one of many of you had said the impact on employee retention on that. I didn't know at the time how connected and loyal I was going to be to EY for their treatment and their support and celebration of me doing this. To be fully transparent, I didn't know going into it if I was going to be supported. I thought I was going to have to do it kind of like secretly. I was like, hey, pandemic project, I'll be behind a screen, virtual, no one will know, grow a baby, go on a medical leave. Like I was fully prepared to go on a mysterious medical leave, for like 3 weeks and have a child and then come back a little bit chubbier and whatever. But ultimately though, I didn't. I was celebrated, and I had the 17 weeks to fully recover. I renovated my house as well, but it's a whole other story. But when I came back, I was so thankful and feeling so supportive, and that will stay with me forever. And so anyway, I just wanted to contribute that feel good story as an example of what can be achieved when you sit back and look at things practically and say, what is equitable here? This person is doing this person's doing this. They're ultimately all involved in having a child, so what does it matter who did what function? Ultimately, we're all trying to support everyone that's involved in bringing these children into the world and raising them.
I love that. Thank you so much for sharing that. Thank you. Truly appreciate it. I had a couple hands here. I'll take 2 more questions and then.
I have a question for any one of you up here. All of you have given a really good case for why you should give great health benefits to your employees and their dependents when they're employees. What happens when they walk out the door, or they're pushed out the door, they retire, there's RIF, whatever, or they, what happens there in America? That there seems to be a bit of a cliff there.
Good question.
Yeah, it's a good question. I don't know. It's one that we can solve, unfortunately, but can at least touch on it. And first, I'm going to say thank you to Lindsay for being a surrogate, just because I appreciate the surrogacy. But to your question, I think that's a function of our American benefit system, right? Our benefits are employer sponsored. When your employment ends, that's a problem. For many organizations, they try, depending on the reason for exit, to bridge that, especially from at least a health benefit standpoint, but there's not really a good system for that. I would say there's probably a tolerable system for that for basic health benefits. There's no system for all these surplus benefits that we're talking about, right? And so I have an appreciation for the problem. I don't have an answer for you. I think the only thing that we can do as employees of organizations is advocate for some bridge function where we can and where there is opportunity to help people get coverage in their next role. I don't know if anyone has good insights there. It's a tough one.
Yeah, it is very tough. Get involved with politics, right? That might help. But it's a hard problem to solve, and it's certainly one that's out there. So thank you for acknowledging it. I'm sorry that we don't have an answer for you today, but it is one that everyone should be aware of and people should be thinking of, is how are we taking care of, I mean, it's all population health, right? How do we take care of humans and not always just our employees?
And, go ahead, no.
The only thing that I would add, especially whenever you brought up a RIF or reduction in force, for the executives that we had online or in the room, definitely something that I would encourage leaders to consider whenever they're working on their packages for whatever separation may occur, to consider those equitable benefits that do, especially benefits like included health, that do drive that major need for a lot of people.
Yeah, I agree. I've had the privilege of sitting in on companies, so I want to give a huge shout out to anyone that worked in benefits, but having the conversation, we are going through layoffs. How does your benefit impact our employees that are going through layoffs? It can be as simple as having that answer for your employees so they don't have to look for it. And knowing that, hey, if they have an open case, it's going to be followed through until it's closed. Now, they can't start a new one, but at least you can let your employees know that when that reduction of force is going on. So benefits people really can help drive that conversation. So if you are building your business case and that's a question you have, really connect with your benefits people to understand what would they do in the process of separation or if there's workforce reduction. And I know we had one more question, but one? Oh, okay. Okay. Well, once again, thank you all for hanging out with us. Hope to see all of you at the Edison and have a wonderful, wonderful summit. Thank you.